Hello, everybody. Good evening. Hello. Hi. It's Thursday again, and we are here for our Facebook Live on nursing prioritization and delegation. So, thank you very much, everyone, for being patient because we had some technical glitches before we start. Anyway, it's Thursday, 7 to 8 p.m. Pacific time. We usually do the Facebook Live on this topic, which is nursing prioritization delegation. So, hello, everybody, for being here tonight. Let's say. Okay, so we have Alan Hill Torres. She's sharing her quote tonight. So the quote is, "If your habits doesn't work, change it, but don't change your goal." Very good. Okay, thank you. We would like to welcome the following. We have Freda Villanueva. Thank you for being here tonight. You may also share your place, your location where you are tonight, so that we can know where you are all coming from. Pragyasha Subidi, thank you for being here tonight as well. Kadiato Trawali, thank you very much for being here. Let's do a little bit of shout out to our students for this Facebook Live. And also, you will notice that in our Facebook page recently, we have a lot of people who has passed the NCLEX. So I'm really very happy. And most of them were telling me that this session that we're doing is really helping them a lot. So thank you very much, everyone. Without further ado, I would like to introduce myself. My name is Mr. Alan Matus, and I am a nurse educator. I have been teaching nursing students for almost 25 years. I'm also a nursing faculty, and I'm the founder of Matus Nursing Review and Matus Nursing Review Online NCLEX Academy. Okay, so what is our agenda for tonight? Okay, everyone, where's your location? So we have Pragisha says she's from Nepal. We also have Lorraine Magno. She's from the Philippines. I think it's your first time here tonight, Lorraine, for our Facebook Live. Hopefully that you'll be learning tonight, okay? And we do have more videos in our YouTube channel, so come and visit, okay? So visit the channel that we have. So we have also from California, we have Alan Hill as usual. She's a regular here. We have exciting topics for all of you tonight, and I would like you to participate. I would like you to put your rationale in the comment section, everyone. Okay, really exciting questions. So hopefully you will learn something tonight on the principles of nursing prioritization and delegation, which for sure are concepts that will definitely come out in your NCLEX examination, everyone. Okay, all right. So again, one thing also before I forget, I'm an author. I have a published book in Amazon, and you can find it there. It's the Simple, Fast, and Easy NCLEX review book, and it is 5 stars in Amazon, and students are buying it, and so far they like the book. So guys, give a shout out in the comment section if you have my book, and how do you find my book, everyone? Okay. So also, a little bit for tonight, we're gonna have your motivational photo of the week. So we have this photo that was sent to us by Faye. Faye is one of our students in the live webinar that we do every Saturday. So we just finished the program, and Faye sent us a photo studying, and of course with the workbook and the online NCLEX Academy. So way to go. Very inspiring. Hopefully that one of you guys will be our NCLEX passers. Okay. All right. And of course for tonight, we are going to have, okay, we are going to have your, okay, we're going to have your free 90-day online access NCLEX review. So who will be the winner? So everybody who joins tonight will be entered into a raffle, and we will announce next week. So please make sure, if you attended tonight, please check out if you won the raffle, okay? Because we announce the winner in our next session, okay? So be excited for that. We will announce the winner before the end of the program, everybody. So we would just like to welcome Benedicta. Oh, Amy. Hi, Amy. So the book helped me a lot in fluids and electrolytes exam. I'm also preparing for myself for the NCLEX-PN exam. Thank you very much, Amy. We have Benedicta. Okay. Thank you for being here tonight as well. Okay. So, and one thing also, everyone, don't forget. Okay. Of course, if you have the time, please share this Facebook Live with your friends so that they will also learn. And also, if you're watching in YouTube, you can also click subscribe. Okay, so thank you very much, everybody. I really would appreciate that. All right. So for tonight, it's really exciting. We're going to be flashing now the questions on the screen. So we'll have your delegation and your prioritization questions. Okay. So we have also, okay, so we have Miriam. Miriam is praying that hopefully she will win the 90-day online NCLEX review. Emily said she got, Amy said she got 93% on her fluids and electrolytes by using my book. So we also have C. Yakulit Ako, and she's also from the Philippines. Okay. Well, anyway, everybody, say a big yes in the comment section if you're ready for our very first question for tonight. Okay. Let's see if we could flash out the question. Okay. Okay. So we have the first question. I have to restart again. Hopefully you can hear me, everybody. Is there a sound? Okay. I usually want to be spontaneous, but this happens. But anyway, let's give you 1 minute, everyone, to answer the question. Okay. So answer the question, everybody. For those who just came in, that was really a very challenging, moment for all of us. We were trying to fix the glitch. But anyway, everybody, I'll read the question again. So the nurse cares for several children in the pediatric unit. Which child would require priority intervention? A, the 10-year-old child with croup who receives steroids to treat laryngospasm. B, the 4-year-old child with Tetralogy of Fallot who squats after experiencing TET spells. C, the 14-year-old child with cystic fibrosis who has persistent cough with phlegm. Or D, the 3-year-old child who has drooling and inspiratory stridor due to epiglottitis. Okay, so most of you answered. Let's see what letter, everyone. Let me see. Okay, so all of you or most of you already have given your answer, guys. Okay, so in this situation, we have to choose the most unstable client. Okay, and you have noticed that in this situation, you have you actually have patients. Okay, patients who are considered to be unstable. Okay, so let's see what's gonna happen here. Let's take this out. Okay, all right, so the answer to that question, everybody, is going to be letter. Okay, so let's see, everyone. So that would be your letter D, everybody. So letter D is the answer. That would be a child with epiglottitis. Now, why is this the answer, everyone? Okay, now this is the answer because we all know that epiglottitis is a medical emergency. It is usually caused, it's either bacterial or it could also be viral, and usually related to infection with Haemophilus influenza virus, type B virus. Okay, and what happens when you have a patient who has epiglottitis is that you have severe inflammation or infection of the larynx, and that causes closure of the airway, and with closure of the airway, it can cause severe hypoxia, and that's why the answer is going to be letter D. The fact also that you have drooling and you have inspiratory stridor. Your letter A, croup, definitely is an airway issue. However, this child already received steroids to treat laryngospasm, so it's not really as serious as compared to letter D. Your letter B, the 4-year-old child with the Tetralogy of Fallot who squats after experiencing TET spells, that is a concern. However, when compared with letter D, D is an airway issue. And with letter B, a child who is squatting after experiencing TET spells or hypercyanotic spells, that probably would manage the condition. Letter C, the 14-year-old with cystic fibrosis. Remember that this condition is characterized by increased production of thick mucus. So letter C is expected for someone having cystic fibrosis, and that's why it is not considered to be that unstable compared to letter D, which is your epiglottitis. So always remember, everyone, that your epiglottitis is considered to be an emergency procedure, okay, or emergency condition rather. So you really have to take care of that child immediately in order to prevent closure of the airway and of course severe hypoxia or respiratory distress. So the answer is going to be letter D, everyone. Okay, so let's go to your number 2 question, everyone. But let's see some comments. Okay, so we have stridor is an abnormal breath sound caused by airway obstruction. That is exactly correct. Okay, we also have epiglottitis. It will block the airway, of course. So one of the things that I really want you to be familiar with in your NCLEX will be the different respiratory disorders and also different pediatric emergencies. Okay, so be aware of that. Now let's go to the second question, everyone. So we have another question, which is we have 4 children, and then you have to choose the child that will be a priority in the situation. Okay, so let's have the question now. All right, so this is a question, everyone. So let's see. Okay, hopefully it will flash on the screen. So you have that question, everyone. So several children are waiting to be examined in the urgent care clinic. Which child should be seen immediately? A, the 11-year-old child who has a runny nose, headache, and sore throat due to common colds. B, the 5-year-old child who sustained multiple fresh bruises in the thigh and flank areas after a fall. Okay. C, okay, so it's not showing, everyone. Let me see. Letter C, the 14-year-old child who has a swollen inflamed right ankle due to sprain. Or D, the 1-year-old child who has tachypnea and barking cough due to respiratory syncytial virus infection. So let me fix the problem, everybody. I think it's showing now, everyone. It's just really delayed a little bit. Sorry for that. So again, we read the question. Several children are waiting to be examined in the urgent care clinic. Which child should be seen immediately? A, the 11-year-old child who has a runny nose, headache, and sore throat due to common colds. B, the 5-year-old child who sustained multiple fresh bruises in the thigh and flank areas after a fall. C, the 14-year-old child who has a swollen inflamed right ankle due to a sprain. Or D, the 1-year-old child who has tachypnea and barking cough due to a respiratory syncytial virus infection. Okay, so let's see what's the answer to this question. Most of you answered what? Let's see. Remember, you have to choose here the unstable patient. You also have to consider the safety of other patients, okay, or other clients. So which client comes first? I think everybody is giving their answer now. Okay, so we have a rationale from C. Ako, youngest and airway problem. Okay, but remember that in the NCLEX, you may be given the different ages, but sometimes or most of the time the age does not really matter. The most important thing you really have to look into is the condition of your patient. Okay, all right, so most of you are giving your answer. Okay, all right, so let's see what is the answer to this question, everyone. So just look at the question. One way to approach this question is to know if the child is unstable or not. With letter A, you have to remember that, are those the symptoms of colds? Is that really an emergency? With letter B, you have multiple fresh bruises in the thigh and flank area. You have to ask yourself, is this an emergency? Is this something that we need to address right away? Letter C, the 14-year-old child who has a swollen inflamed right ankle due to a sprain. Is this something that we need to be concerned about? Or letter D, the 1-year-old child who has tachypnea and barking cough. So the answer to this question, everyone, is going to be, very good, everybody. You got the right answer. That would be letter D. Okay, so the answer is letter D. That would be the 1-year-old child who has tachypnea and barking cough due to a respiratory syncytial virus infection. Now, why is letter D the right answer? It is because, number one, RSV is not characterized by barking cough. The fact that the child has barking cough means that maybe the condition is getting worse. Okay. Also, the fact that you have tachypnea. Tachypnea is increased respiration. So this child is in respiratory distress. And one thing that you need to remember as well is that your respiratory syncytial virus infection is a highly contagious disease. Highly contagious disease. Highly infectious. You can easily spread this. And in the comment section, I would like you to put, what is the mode of transmission for respiratory syncytial virus disease, everyone? What is the mode of transmission for that? We all know that it is a form of pneumonia, especially among children who are below 2 years old. It is a viral infection. What is the isolation precaution for respiratory syncytial virus disease? Can you tell everybody? Okay, this RSV is going to be contact and droplet precaution. Very good. Droplet and contact precautions, especially your contact precautions. It's almost akin or similar to COVID. You know, like COVID is also highly contagious. You know, we need to make sure that we clean the environment, we wash our hands, sanitize the environment. The same thing for your RSV, everybody. It is contact and droplet. So in the NCLEX, remember that the isolation for this is contact isolation, and then also droplet precaution for this patient. So you need your gown, you need your gloves if this child is in the hospital. All right? Okay. So very good, everybody, for getting the right answer on that one, everyone. Okay. So we have a okay. All right. So the most important thing is the fact that you have tachypnea and barking cough. You know, you may want to look at the age, but is age really something that is important in that question? I don't think so. The most important thing is really looking at the clinical description. Okay, the clinical description or the condition of your patient, everyone. Okay, so thank you very much for that. Those two questions, everyone. Be aware. You know, you have airway issues there, and that's good that you're getting the right answer. So in the NCLEX, you may be having those types of questions. You know, some questions could be very difficult, but then when it comes to other questions in the NCLEX, they are direct to the point. Okay, so remember. So now let's go to your delegation and prioritization, everybody. The delegation questions now. Are you ready for delegation? We have prepared nice questions for you. So let's see if you get the right answer for this. Okay, so your first delegation question is about the UAP again. We have the RN and then the UAP. And always remember that we said the RN usually delegates to the LPN and to the UAP. The LPN can delegate to the UAP, but the UAP cannot delegate to the RN or the LPN. Only the LPN or the RN can delegate to the UAP. So our question for delegation is going to be, the registered nurse is giving assignments to the unlicensed assistive personnel in the pediatric orthopedic unit. Which of the following tasks can be delegated to the UAP? Select all that apply. A. Obtain routine vital signs. B. Change sterile wound dressings. C. Place the side rails up as ordered. D. Pass the food trays for breakfast. E. Perform range of motion exercises. Or F. Measure the urine output from the indwelling catheter. Okay, again, the registered nurse is giving assignments to the unlicensed assistive personnel in the pediatric orthopedic unit. Which of the following tasks can be delegated to the UAP? Select all that apply. You will notice that even in some other books about delegation, you will notice that the questions are just really straightforward. And that's what I would like you to do. You know, in the NCLEX, I want to make sure that you can answer select all that apply questions, especially about delegation. Okay. And I would say that if the question is very easy, that's great. You know, you should be getting the right answer. Always remember our memory trick or guide to remember what should be delegated to the UAP. The considerations or the factors. That would be, it has to be a stable patient, number one, stable patient. It has to be within also the scope of practice of the UAP. And lastly, it has to be a simple routine. So the answer to this question for most of you, okay, all right, okay, simple task only. So let's see if you got the right answers, everyone, to this question. Okay, um, I can see some answers. Okay, okay, very interesting answers, everyone. Some people are still putting their answers also. Are those your final answers, everyone? Okay, all right. Okay, very interesting. We have different answers in the comment section. Okay, all right, so let's see. We have a controversial question last week. Last week, we had a controversial question, and I kind of like fixed that a little bit, and we'll discuss a little bit about that today. All right? Okay. So the answer to this question, everyone, okay, is going to be your A, C, D, E, and F. I think Amy Michael said all except B. Congratulations, you got the right answer for that one. Mai also got the right answer. Congratulations also, Mai, for getting the right answer. Okay. We also have Kenny Tetang also getting the right answer. Very good. All right. So the answer to this question is going to be A, C, D, E, and F. Now, why is A, C, D, E, and F the answer? Can UAPs obtain routine vital signs? Yes. Last week we have that question wherein the question was, can LPNs obtain routine vital signs? Well, in the question, I checked different sources actually. Even if it's only LPN in the question, we'd rather the answer to those NCLEX review books. Okay, the answer usually is that they said that routine vital signs should always be given to the UAP. So let me just clarify that because that was a question last week. So if you have LPN and then RN in the situation and the RN is delegating to the LPN, based on those resources, do not choose obtain routine vital signs for LPNs, okay? Because routine vital signs are supposed to be for UAPs, routine vital signs for stable patients. And I checked two resources, okay? Two resources. So be careful with that in the NCLEX, everyone. But the one thing that we know about LPNs is that LPNs can do specific or focus assessment. They can check the color of your stool. They can auscultate your bowel sounds. They can also auscultate your heart sounds as well. Those are the specific assessments of LPNs. Okay. Now, letter C, that's within the scope of practice of your UAP. UAPs definitely can place the side rails up as ordered. Okay. Letter D, pass the food trays for breakfast. That's the responsibility of your UAP. Also, perform range of motion exercises as well. Okay. So you might be thinking that, oh, range of motion exercises should be for the LPN or RN, but it could be for the UAP. And letter F, measure the urine output from indwelling catheter. That would be for the UAP also, they can do that. But again, all of this can be done by the UAP if the patient is stable, okay? Or if the client is stable. Remember that. Do you think that the UAP can take care of or do a range of motion exercise to a client who is newly admitted with multiple fractures, for example, or let's say it's a patient who is unstable and then you have to do range of motion exercises? If we think that it is a complex situation, there's a safety risk involved, then maybe ROM could not be done by the UAP. But since in this situation it doesn't really say what kind of patient is presented, then the UAP can do all of those things. Another situation that I will tell you, for example, is this: feeding. Feeding is within the scope of practice of the UAP, okay? But if the client has dysphagia or a swallowing problem, then I think it's not something that we want to delegate to the UAP since the client has dysphagia. So again, remember that when we delegate to the UAP, we have to give clients who are stable, clients with predictable outcomes, clients that are not having acute emergencies or acute conditions, everyone. So be very careful about that. In this situation here, what you have is direct to the point scope of practice of UAPs. But if you have a client together with these responsibilities, you have to look at that client first. Can we really assign to this UAP this client? Ask yourself, is this a complex? Is this a stable client or not? Okay, so very good, everybody. You got the right answer. That would be A, C, D, E, and F. All right, very good. So let's see if others have comments. Okay. LPNs can change sterile wound dressings, correct? Of course, LPNs can do that, but UAP cannot change sterile wound dressing. You know why? The word sterile itself, okay, sterility, that is a safety issue. We want to give that to a licensed nurse who is able to apply the principles of surgical asepsis, especially with wound dressing changes. Okay, so that's correct. LPNs. So, but then your UAP cannot change sterile dressings. Okay. Okay. If the client is unstable, then the RN will be the one responsible for that patient. Definitely. Okay. When it comes to turning or repositioning, if it is unstable patient, then maybe that's something the RN can do. Okay. Feeding is for LPN. LPNs can feed definitely, but only when you have an emergency and you don't have UAPs around. However, if you have UAPs, feeding will be for the UAP. Anything that is activities of daily living, anything that is a simple routine, that you give that to the UAP. Okay. All right. So we do have other questions also. Okay. I'll be going over later on the comment section and I'll be answering them as well. So put your questions there, guys. The comment section is very fast. I'm having a hard time looking at all of your questions, everyone. Okay. So, all right. CNA. CNA is in other states, especially in California, we call UAPs here as your certified nursing assistants. In other states, UAPs have different title designations also. They could be orderlies, they could be healthcare personnel, assistant, so different in other states. Okay, so UAP is your CNA or certified nursing assistant. Okay, especially here in the West Coast or in California. Okay, all right. So, okay, so I'm going through all the other questions, everyone. Hopefully you got that right. So congratulations for those who got the correct answer for that question. It is really very challenging though, sometimes, why? Because different states have different scopes of practice. And sometimes it's hard to kind of like really say what is the correct answer in the NCLEX. So it entails a lot of research, a lot of comparison with different resources, different books on what they're saying about delegation and prioritization because of the differences in the scope of practice in the different states. But of course, we have to go back to the general principle that the NCLEX is the ideal world as much as possible. Okay? All right. So let's proceed to the next, everyone. We have number 4 question. Okay? So for number 4 question, everybody, okay, I think we have a, okay, let's see. All right. So, okay, so we have number 4, everyone. Okay. This is number 4. So we have a question in the comment section if the CNA or UAP can change a colostomy bag. Wow, that is a controversial question because we need to really think wisely or, really carefully if the UAP can change a colostomy bag. Okay, you just have to remember that changing a colostomy bag, there are some measurements that you need to do. You need to make sure that there is a 1/8 inch opening. So you have to ask yourself, if it's a complex procedure and there's a danger involved in changing the bag, especially with the circulation of the stoma, then you might give that to the licensed nurse changing the colostomy bag, because it also requires assessment of the stoma. Okay, so but I may be wrong, but I may be giving my feedback to you on that later on. Changing the colostomy stoma, if colostomy stoma bag, if that could be done by the UIP. I'll give you the response later. At this time, I'm not really very sure. However, the fact that your colostomy bag, when you change that, there's measurements involved, there's principles that you need to remember, skills. So we need to make sure that there's no safety involved there, or safety risk. But for now, let's go to your next question, number 4. The registered nurse and licensed practical nurse care for several children in the pediatric unit. Which client is most appropriate to delegate to the LPN? A, the 12-year-old child who needs scheduled pain assessments due to vaso-occlusive crisis. B, the 7-year-old child who must be evaluated after receiving steroids for laryngotracheobronchitis. C, the 4-year-old child with spina bifida who requires intermittent catheterization several times a day. Or D, the 8-year-old child with leukemia who is being treated for acute urinary tract infection. So I'll read the question again. The registered nurse and licensed practical nurse care for several children in the pediatric unit. Which client is most appropriate to delegate to the LPN? Okay, A, the 12-year-old child who needs scheduled pain assessments due to vaso-occlusive crisis. B, the 7-year-old child who must be evaluated after receiving steroids for laryngotracheobronchitis. C, the 4-year-old child with spina bifida who requires intermittent catheterization several times a day. Or D, the 8-year-old child with leukemia who is being treated for acute urinary tract infection. Okay, so the answer is going to be letter. Okay, so you have to make sure that we are delegating a client or a child to the LPN, a child who is considered to be a stable child, somebody with predictable outcomes. Okay, so let's see. All right, so the answer to this question, everyone, okay, is going to be, all right, everybody, so the answer is going to be letter C, everyone. The 4-year-old child with spina bifida who requires intermittent straight catheterization several times a day. All right, so we have Manu. Manu actually is really telling us the reasons or the rationale for the answers. Okay, so very good, Manu. Okay, and she said the answer is going to be letter C. Very good. What about the others? What are you saying, guys? Okay, someone said that, Chiri said that LPNs can do catheterization. A, B, and D are complex patients. Now, if you don't know, everyone, Charlie's already passed her NCLEX RN, but she's still joining our Facebook Live every Thursday, and that is nice. Okay, RNs do assessments, evaluation, and teach. Very good. Okay, A, assessment will be done by RN, and steroids is also given by RN. And remember, guys, the answer is letter C, because why? This is a more stable patient. It is a spina bifida child, and you know that children with spina bifida usually have motor paralysis possibly, and then also bladder and bowel problems. So they may require intermittent catheterization several times a day, and the LPN can do that. Now, letter A is an unstable client. Remember that. Letter A, unstable. Vaso-occlusive crisis. Can someone tell me in the chat box who are these clients or children with vaso-occlusive crisis? What condition causes vaso-occlusive crisis, everyone? Okay, what is that condition? That would be your sickle cell anemia, right? So letter A is unstable, so don't give that to the LPN, especially scheduled pain assessments. Letter B, 7-year-old child who must be evaluated after receiving steroids. Evaluation, that has to be the responsibility of the RN. Remember, you don't delegate it. Evaluation, assessment, and your teaching. Letter D, the 8-year-old child with leukemia who is being treated for acute UTI, of course, that is also an unstable client as well. So literacy, that's part of the scope of practice of LPNs everyone. So that's why literacy is the answer, guys. So I think most of you got the right answer, and I think all of you are ready to pass your nursing licensure. Okay, when the question is all about delegation and prioritization, everyone. Okay, I hope that you learned something tonight, guys. Okay, all right. So I would just like to present very quickly, guys, that for our program in the online NCLEX Academy, you can get the workbook for $94.50, and then you can also enroll in our online program for $49 a month. The total of that is going to be $143.50. So very affordable, and you can watch the videos, my lectures, while you're filling out the workbook, okay? And that is an interactive review. So if you graduated like 20 years ago, 10 years ago, 15 years ago, it doesn't really matter, or new graduates, this is a program that will give you the content that you need to pass your NCLEX. As I told you, always remember, number one tip, you need to know your content before you can answer practice questions successfully. All right? And just a very quick announcement also, everyone, we will have our live webinar, okay, 10-day live webinar program. I'll be doing lectures from November 7th to January 16th. That's every Saturday from 8 to 4 p.m. everybody. So if you need more information about that, just visit matusnursingreview.com. Okay? All right. So before we end tonight, everyone, we're going to announce the winner for our 90-day online NCLEX Academy. Okay, access. So are you excited, everyone? Who is going to win tonight? Okay, and next week, everybody, you need to join again so you can see if you won the 90-day online NCLEX access. All right, the Academy access. So the winner is Liza Sibayan. She joined us last week. So congratulations, Lisa. She's the winner. Okay. All right. So congratulations, and hopefully, guys, tonight you enjoy the questions that we have. And Lisa, please send us an email so that we can enroll you in the program. You have 90 days and join the hundreds of classmates that you have right now in the academy, everybody. Okay. And I'll go back to the comment section later on to answer some of your questions, everyone. If you have questions about the program, put that in the comment section. All right. So congrats, Lisa. Okay. And don't forget, everybody, in your NCLEX right now, your minimum number of questions is 75. Your maximum is 145. And the number of hours maximum is 5 hours, everybody. Okay. So thank you very much, everybody. I hope to see you. That would be next Thursday. And hopefully we fix the technical glitches. So I really appreciate your being patient tonight. Okay, so again, this is Mr. Alan Matus, and I'm here to provide you service, especially providing you content review, making everything simple, fast, and easy for your NCLEX review, everyone. Thank you very much, everybody, and have a good night.